In Australia, there's about 4 million people who have a mental health problem. Understanding big problems like mental illness requires a large national response. And the Medical Research Future Fund really allows us to do that. I sit on the Million Minds Advisory Committee. Our role is to help shape the way in which the Medical Research Future Funds will be used in the cause of mental illness. Many young kids in their early teens start to develop mental health problems like depression, anxiety and so on. However, we do know that around 22% of those young people could be prevented from developing these disorders in the first place. The Medical Research Future Fund has contributed $125 million over 10 years to try and make a difference to the lives of people who have mental health problems. At the moment, we have 3 different areas of particular interest. One is mental health issues in young people and adolescents. A second issue is around eating disorders. They cause so much suffering and severe disablement. And the third one is Indigenous mental health, because we know, for example, the suicide rate in Indigenous young people and adults is 2 or 3 times higher than that of non-Indigenous people. The Medical Research Future Fund aims to focus on translational research. Australia is very good at discovery, but we're not so good at getting our innovations into practice. In fact, we rank much lower than comparable countries around the world. And I think the Medical Research Future Fund is a way in which we can bring that investment to make sure that our discoveries are kept here in the country and actually lead to major transformative healthcare change into the future. The Medical Research Future Fund is really important for Australian health. I'm totally committed to mental health. Like many people, I've experienced mental health problems myself. I've had family members with mental health problems. I think there's a lot of stigma associated with it, but I actually think science and research is the answer, both to reduce stigma, but also to make the innovations that we need in this space.